Right. Good afternoon, everybody. Hopefully you can all hear me. And thank you very much for choosing to join me for this session this afternoon. My name's Sarah Caney, and I'm going to be presenting hopefully a few slides which will last, I would say, about 10 or 15 minutes, after which we can have a Q&A session. So on your controls, if you're not very familiar with Zoom, and I still fall into that category myself, then it might be helpful to know that there is a chat box. So you might have to, on the control panel, click on the More option to find that chat box. But if you open that chat box, you can then type a message either to me privately or to everyone, and we can therefore answer questions in that way. But also at the end, I'm very happy for you to unmute yourselves and actually ask me a question directly. So whatever you would prefer is absolutely fine for that. We will be recording this session. This session is already being recorded. So we will also be able to, if you would like, send you a link to this recording after the event. So if you want to listen again, hear something that I've said again, then you can obviously access that recording. Also, if you would like a copy of the slides that I've used, please send us an email. I've put the email address at the bottom of this slide, info@vetprofessionals.com, and that's our general mailbox, and we'll be able to send you a copy of the slides if you would like them. So the purpose of this presentation was to tell you a little bit about COVID and its relevance to you, possibly as a cat owner. So I have a little bit of background information on COVID and ourselves, and probably don't really need to say this because we've had so much information constantly coming at us every day about this. But just a very brief reminder that COVID is the illness, coronavirus illness, and it's called COVID-19 because it was first documented in China towards the end of 2019, and it's caused by infection with a severe acute respiratory coronavirus, a SARS coronavirus number 2. And so the virus is the SARS coronavirus, the illness is COVID. And as you'll all know, this was a problem that first emerged in China, but now is affecting pretty much every country in the world. And in the UK, where I'm speaking from, we're going through very sad times at the moment, as every day more cases of infection and more people are dying as a result of this, the illness caused by the infection. And again, as you'll know, that overall it does seem that this virus is very infectious to people, and it is more serious than our typical seasonal flu. And so overall, about 1 to 2% of people are expected, unfortunately, to die as a result of this illness, which is a much higher number of people dying than would be typically seen with seasonal flu. But also we do know that if you have underlying disease, and also if you're an elderly person, that your risk really increases steeply as well. But it's obviously affecting people of all ages. Tragically, yesterday we heard that, or I think it was released in the news yesterday, that a 12 or 13-year-old child had died in the UK as a result of this infection. So it's causing obviously a lot of concern, and the purpose of this presentation really is to talk about how this whole situation might affect us as cat owners. I've put a couple of websites on the bottom of this slide, the World Health Organization and the World Small Animal Veterinary Association, as two, I think, very sensible, reputable websites that are updating their information to reflect our current knowledge, because as you will all appreciate, every day something new emerges in the press. So what do we know about this situation in terms of the animal population? Well, at the moment, there's a lot we don't know. Information is starting to come out, and whilst at the moment I think there's no confirmed cases where a pet has become ill or died as a result of COVID that have been confirmed, there have been some situations where the virus has been identified in pet animals. And to start with, this was actually in Hong Kong, where a couple of dogs were found to be positive on the virus test. And there were some questions at this stage about the significance of that. I think the dogs were not unwell, and it wasn't certain whether they were perhaps finding virus that had been shed from the people that were looking after them, or whether the dogs had a low level of infection. But that was the first little bit of news that came out in terms of pets. But you all probably have heard more recently that there have been some reports of cats where infection has now started to be mentioned. So last Friday, there was a case report from Belgium, from the University of Liège, where a cat that was unwell, showing some respiratory and gastrointestinal clinical signs, and that lived in a house with a human sufferer of COVID, someone who I think had returned from Italy and had the infection. And some secretions from this cat were tested for COVID and found to be positive for the virus. The cat, to my knowledge, is actually doing fine, and there still are significant questions as to whether the virus that was found in these secretions was perhaps contamination from the environment and the owner who had this infection, or whether this cat genuinely was infected with the virus. I think that still has not been proven. And of course, everyone who's finding any information about COVID is pushing it out into the public domain as quickly as possible, which is great on the one side because we're hearing this news as it happens. But on the other side, one of the problems is that we don't always get the peer review process happening. So for example, that case report, there are some unanswered questions which we still don't know, because we just know what these researchers pushed out into the public domain. I also read in a newspaper article today that there was a second cat case where COVID had been isolated, but I wasn't able to find any more information about that. So I don't know where that cat is, for example. And then the other news that came out yesterday with respect to cats was a study done in China where actually this is an experimental study where some researchers took this SARS coronavirus and then tried to infect various species of animals. And so you will, if you Google, be able to find the text of this article. Again, it's not been through the peer review process. These researchers are releasing it more widely just to alert people to their findings. But what they did was that they actually experimentally, so very much under laboratory conditions, infected animals of a variety of species. And from a cat perspective, they found that they could infect cats and that some of the infected cats could spread that infection to other cats. So evidence that the virus was able to grow and replicate, so a genuine infection in the cats. So what does this mean to us? How should we view these results? Well, firstly, I think be careful, because this isn't a study that's been through the peer review process. So we're not seeing the full details of the methodology and the testing to be able to scrutinize that. Also, bear in mind, this was a very much an experimental study. So it involved taking a small number of cats, all quite similar in age. I think they were all about 8 months of age, so not a cross section of normal ages of cats. And they artificially infected them by actually dropping virus into these cats' noses. So they basically had probably a little syringe or pipette, and they were dribbling virus, a huge dose of virus, into these cats' noses. So this probably really doesn't represent what would happen in a normal situation where a cat may be living in a household with someone with coronavirus who's coughed on by that person. The dose of virus and obviously the route of infection are going to be very different to what was described in this study. Importantly as well, the cats weren't reported to be unwell. So from a reassurance as a cats, you know, from thinking of our lovely companions, these cats were not unwell, but they did find that when they looked at the tissues from these cats after they were put to sleep, that they could find evidence of disease in the respiratory tissues. So I guess illness is possible, but that's we can't say fully anymore. Again, it's a very experimental study. It's not going to represent what's happening in the normal household. I do believe that the results are credible in the sense of these cats being able to be infected and replicate that coronavirus, because in fact with the SARS outbreak of disease in people in 2003, scientists did document that cats could be infected with that virus and that they could replicate it and shed infection. So it's not, I think, surprising to find that the Chinese study has reported that, but important to remember that in the big scheme of things, you therefore may be wondering, well, how important would the cat be in spreading infection? And certainly based on the SARS research in 2003, cats were not thought to play a role in the spread of disease at all. All of the cases of SARS that were reported were felt to be traceable to contact with infected people. So epidemiologically, in terms of spread of disease, it would be, based on the SARS information, unlikely that the cat is going to be a source of infection. But it may be a reason why in the future, actually following the progress of this disease in ourselves, that it may be helpful to consider testing of our pets, in contact pets, if we are unwell ourselves. And in fact, one of the very big global veterinary laboratories, IDEXX, and they are based in pretty much every country of the world, and almost every vet practice that has their own laboratory will use IDEXX equipment. And several weeks ago, IDEXX developed a PCR test which looks for virus nucleic acid, so the signature of the virus, if you like, and what's often in our own reporting referred to as an antigen test. And they've developed a test for this, and they decided to just test what samples they had coming through. And they tested, as you can see, hopefully read on your screen, more than 4,000 samples from cats, dogs and horses. And whilst these came from a variety of locations, they weren't specifically from households where COVID was known to be there, because really IDEXX just wanted to develop a test and try it out. And so the bottom line is that actually they didn't find any positive samples at all. So it's, I think, useful to know that there is a test available on the vet side. It's not commercially available to us yet, but they've obviously developed it so that if we do need it, that will be available to us. So should we at all be worried about catching this coronavirus from our cats? Well, in absolute honesty, of course, as a scientist, I'm going to say we don't know fully, because we only know some of the information at the moment. There are certainly some theoretical ways that a cat could transmit infection to us. So for example, if we have a cat that goes outside the home, if it comes into contact with the virus, perhaps it's a cat that likes visiting neighbors' houses and one of the neighbors is unwell and potentially coughs on the cat or coughs on their hand and then strokes the cat, then that may offer a passive way of our cat to bring infection into our household. That would be the fomite option that I've put on this slide here. So fomites are objects that just passively carry infection through the environment. And in normal vet terms, we might talk about sharing a food bowl or a litter tray to be a route for fomite spread, for example, with cat flu. If you're sharing a food bowl, or the bedding, that could spread that infection. The equivalent for ourselves is things like doorknobs, where we're now being told if we leave the home to obviously wash our hands whenever we touch surfaces, because the virus can survive on surfaces, sometimes for 24 hours to our current knowledge, and hard surfaces like steel and plastic and cardboard have all been shown to potentially have viable virus on after certainly many hours. So the cat could be acting like a fomite in that sense, but also as per that Chinese paper I was just talking about, I think it's certainly possible that cats could become infected themselves if, in particular, if living with someone who has had COVID and exposed to the virus through their owner. And the cat may well remain well, as was the case with the SARS cats and the Chinese paper I've just talked about, but could be shedding some virus themselves that could be a source of infection in the environment at home. So I think in general terms that all of the risks from cats are extremely low. This is not going to be a dominant route of infection to our current knowledge, and the dominant route is very much person to person. But if you are in a high risk category yourself, if you've had one of those letters from the NHS saying do not leave your house, and that you are particularly at high risk from this infection, if you do have a cat that goes outside the house, then maybe you would want to minimize your contact with your cat a little bit, and certainly wash your hands very, very thoroughly after handling them to be on the safe side. If your cat's indoor only, then of course that's fine, because the cat's not going to be going outside and meeting new infections. So I definitely don't want to make anyone worry about cat ownership as being a route of transmission. I think still all of the focus is on person-to-person transmission. That is the dominant way. But these are some ways that potentially, I think very, very low risk, but potentially could transmit infection via a cat to a person. If you do develop or suspect you have COVID yourself, then certainly if you can quarantine your pets with yourself, that is a good idea, because that hopefully helps minimize spread outside your household. And again, with cats, it's not always easy to alter their lifestyle. So we have to be practical as well about what is possible. But certainly if your cat is the sort of cat that likes going into the neighbors' houses, then try and send a message to your neighbors just to say, please, block your cat flap, or don't let my cat in at the moment because I am quarantining at the moment. That sort of thing might be helpful to pass on. And also relevant is if you do have COVID yourself, is if you do need to go to the vet, if your pet develops an emergency that requires veterinary attention, then ideally don't take your animal yourself. Someone healthy ideally should take the animal, and make sure the vet clinic know that you have had or suspect you've had coronavirus in your household, so they can take the appropriate precautions to minimize their risk from handling your cat as well. So what other tips can I give you that relate to this situation? Well, the focus really for the rest of the presentation will be on how we deal with the lockdown situation that we're all under at the moment. So vet clinics are still open. However, they have been told to minimize visits from the public in terms of transmission of disease, and therefore focus really on the patients that absolutely need to be seen. So emergency cases and patients that have illnesses that are thought to be at risk of deteriorating in the short term. So they may appear to be closed to you in the sense of having a locked front door, but they are still very much open. Many vet clinics are also dividing their staff into teams that work together but don't overlap, as it were, so that if anyone in any of the individual teams gets unwell, then that team can be quarantined, but there still are other teams available to keep running a service at the vet clinic. But that, of course, may mean that the manpower day to day is less than normal, and therefore it may be a little bit harder getting through on the phone to speak to vets. And I think all clinics are working very hard, and like all of us at the moment, are feeling quite anxious and worried about what's happening, and perhaps day to day things are changing. Some situations may get a little bit easier to deal with time, but it obviously is very difficult times. So I think try and be aware of those difficulties that everyone is facing as well. General advice is for things that are genuinely elective, so non-urgent, is that they are delayed where at all possible, but with discussion with the vet. So if you have an animal that's booked in for a checkup next week, then do try and speak to the clinician, try and arrange a telephone discussion where you can still have that same progress update and the same discussion of medications, for example, and of course medicine supplies. Vets will still be able to provide those where needed. And in fact, the rules have been relaxed to allow vets to legally make prescriptions over the phone where they feel that is needed now. So we don't have to actually lay our hands on the patient to be able to make a prescription, which is our normal situation. This is a poster that I got from the WSAVA website and various vet organisations contributed to, and it just has a little flowchart for things to consider when visiting your vets. And firstly would be to phone them first of all. Don't obviously just go and turn up, not that any of you would, but phone first or email. Try and resolve whatever worries you have over the phone. Bear in mind that it's quite likely they're going to say, we need to phone you back, that you might not be able to get your question answered immediately. Where a visit is needed, ideally just one person should go in with the pet, and that person should be a healthy person. Many clinics are offering a way of working that means that you don't actually go into the clinic at all. You may actually hand over your pet and then go and sit in your car and phone through to the clinic, and the consultation with you happens by phone whilst your pet is being examined and any treatment administered. If you do go into the clinic, of course, just be careful with touching surfaces, wash your hands, use contactless payments, all those sorts of general tips that are coming out in our shopping and general trips outside the house at the moment. Genuine emergencies, well, if you are really worried about your pet, then you will often not, some of these things, you wouldn't need to even think, is this an emergency? You just know. If your animal is collapsed or seizuring or bleeding, don't hesitate to phone the clinic and ask for urgent advice. Some examples of things that are genuine emergencies in cats would also, that I'd like to highlight on this, would be if you have a cat that is straining and unable to pass urine, then that is a life-threatening emergency. Typically within as short a period as 24 to 48 hours, it can result in death. So that is definitely not one to delay, but also difficulty breathing through the mouth, very repeated vomiting where an animal's not eating or drinking and not able to hold fluids down. Those would all, of course, be genuine examples. But if you are worried, whatever you're seeing, then don't hesitate to pick up the phone. What about vaccinations? Well, if your pets are due any vaccinations at the moment, if they've had their primary course as a kitten and a booster at 1 year, then really you shouldn't need to worry about a delay in their booster, because they will have good immunity, and it does last in general longer than the vaccine manufacturers' guidelines. So we always have this little sort of buffer zone anyway. So a delay of even 3 months, 6 months is probably not going to have any adverse impact on your cat's immunity. I did put on this slide as well that there is an FIP vaccine available in some countries. And FIP is an illness that we see in cats caused by feline coronavirus infection, a rare, very unpleasant disease. And there are, as I say, some countries have an FIP vaccine, which in my opinion is not a great vaccine. We don't have it in the UK, but also just out of interest, there's no evidence that it would offer any protection to COVID for your cat. So that's not something that I would be recommending anyone went out to do, even if it were possible. Cats that potentially are more at risk are kittens that have not had their full immunizations, and those that have not had their booster at 1 year. And so they may not be fully protected. And ideally, for certainly the kittens, if you can keep them inside only for longer until they have their immunizations, then they will have better protection. But that may or may not be practical for you. And if you're in a relative low density area of cats, then the risk will be will be low. But again, this is the sort of thing that maybe have a chat with your vets about, because they know your cat and their individual risk profile. So this is some information from WSAVA, which just reiterates some of that. The puppies and the kittens that have not had their full vaccines are the ones that are potentially at a higher risk, and may definitely will need more catch-up vaccines after the lockdown restrictions are eased. But do speak to your own vets, make sure that you maintain your communication with them. Other websites that you might find helpful, well, iCatCare, International Cat Care, has a huge number of resources for pet owners. My website, if you've not already had a look around, has got plenty of free to access resources, but also some educational resources that might be of interest if you're dealing particularly with cats that have long-term health problems. I mentioned the World Health Organization, also WSAVA, and then the other one on here is the Blue Cross. They've got a first aid guide, which is quite a useful resource to have a little look at. So in summary, from a cat ownership perspective, don't worry about the elective procedures being postponed, because for most patients, it's actually not going to have any significant harm to them. But do call your vets and discuss with them, because if your cat or any of your other animals have ongoing health issues, then the longer the lockdown goes on, the more issues may start to emerge in terms of not having access to that normal vet care. But vets clinics are working really, really hard to try and offer as broad and full a service as they possibly can. As I've already mentioned, we can prescribe medications over the phone now, which is a change to our professional rules and guidelines. So there's lots we can do. Hand washing, normal disinfection is the mainstay, as well as social distancing for ourselves and reducing the risk of coronavirus. Just a final comment there with the Dettol, any phenolic disinfectants, these are things that make the water look cloudy when you add them, are toxic to cats. So if the only disinfectant you have in your house is Dettol or a similar product, then the relevance of that is that you can still use it, but you must really do all you can to rinse it away from surfaces it's been on afterwards, because otherwise, if your cat walks over those surfaces or comes into contact and grooms it off, it can cause a lot of irritation and upset. So obviously avoid that. But normal other disinfectants like bleach are effective against this virus. It's not a particularly tough virus to kill. So thank you very much for listening, and thank you for coming along today. If you do have any questions, feel free to unmute yourself, or alternatively, if you want to be a bit more anonymous, you can put a comment in the chat box for me. And just a reminder of how to get that is on my computer anyway, there is a list of menu things that come up when I move around on the screen, and one of the things on that bar says more, and then the chat group is an option to click there, and you can type a message which can either go to everyone or it can just go to me, and I will do my best to answer it.